These rural Ugandan village homes reflect the modest realities of life in many communities. Families work tirelessly to survive, but often face preventable illnesses like epidemic malaria brought on by their living conditions. Here, amidst these struggles, a vision for change begins to take shape. Across Uganda, villages like Adjumani face a growing healthcare crisis. Mothers and babies confront limited access to medical care as government facilities, stretched thin for a population of over 45 million, lack the necessary resources for medicine and staff. But this is not just a story of challenges. It is an inspiring story of resilience and transformation.
Dutiri ofisi jo lazo ko barangwani to ofisi mae to kparara resiti dajo ofisi city yo testi nyalele ki koni nyere kani koni pe ko ba dutiri kengwe nane asini ki ko lo ero ajo ya ni bakani koni ra ki anidru ko la city ne ko la nyundu o ba dutiri ne o kparara reledi ke ko amane.
This story takes place in Adjumani, Uganda, and is being mirrored in other villages through the work of the MAAP Foundation. Together, they are building a new habitat for healing, turning compassion into action. Local leaders, like Father Kizito, the Catholic assistant parish pastor in Adjumani, listen and step up to address the healthcare crisis. But he cannot do it alone. Fortunately, he has found a partner in the United States willing to share his vision. The Chicago-based all-volunteer MAAP Foundation brings 10 years of experience working with communities like Adjumani to chart a path forward.
Being concerned about the needs of our community, especially the levels of poverty that even affects the health service access to our people, especially the refugee community and our rural community. We conceived this PGRE project as an income generating activity, and I think it should be thought of as a project with a rippling effect.
In this story, Father Kizito called together local leaders to explore the idea of connecting with MAAP Foundation staff based in Uganda. With his farming background, Father Kizito proposed building a profitable and sustainable pig farm to fund community healthcare initiatives. He writes a compelling proposal outlining the community's needs and detailing a business plan for the farm. Father Kizito requests a $5,000 grant from the MAAP Foundation. In Chicago, with input from Ugandan farm and business experts, the MAAP Foundation reviews the proposal. Olivia, a MAAP Foundation mentor and project supervisor, outlines essential requirements to ensure the project's success.
The key components of a successful business plan include a timeline. We must know for how long is this project going to take? When are we going to see the results? Is it continuous? Is it a one-time project? The second component are the beneficiaries. What is our target? As MAAP Foundation, we mainly target rural communities, but specifically mothers and babies. So are the mothers going to benefit out of the project? Are the babies going to benefit out of the project? Then the other aspect, we look at the sales projection. After this project has been implemented, how long is it going to take? How much are we going to benefit? What are the profits? How much percentage is going back to the clinic or to the community to help our mothers? How much percentage is regenerated in the project for its continuity?
The grant comes from generous U.S. donors who invest in Adjumani without expecting repayment, simply because they believe in the power of change. Before receiving the grant, Father Kizito completes a business training refresher course. With the first $2,500, he begins construction on the pigsty. The second $2,500 allows him to hire workers, purchase livestock, and arrange veterinary care. Eventually, the pigs are ready for market and the profits are reinvested into healthcare clinic initiatives. Father Kizito envisions the Habitat for Healing model expanding across the community, bringing healthcare and hope to all.
So our intention is to be able to now provide those piglets to the community. The selected families, the selected households will eventually initiate their own small piggeries, which then will give us a kind of possibility of not even caring for them directly from this project alone, but from whatever they themselves are also able to do. So we'll train all those we are going to involve, especially the youth, the women, and even the girls. The girls will be training them to start their own projects, and so their families can have access to income.
The MAAP Foundation now invites U.S. and global partners to help replicate the success of Adjumani in other locations that desperately need support. In African culture, we call this spirit of working together Ubuntu. I am because we are. Over time, we prove and improve our microfinance strategy. With your support, we expand this map of healing and bring hope to countless communities, like Adjumani. Visit maapfoundation.org today to learn more. Donate online and help us create habitats for healing. Together, we are turning compassion into action.